Hi, everybody. It's Dr. B here with Bellissima Dental Boutique, and today we're going to be discussing veneers and the entire veneer process. So who can benefit from veneers? People that want to enhance their smile, making it bigger, whiter, bigger teeth, fuller, replace missing teeth. Those are the people, or even straighten your teeth. Those are the people that can benefit from veneers. What exactly is a veneer? A veneer is kind of like a contact lens thick of porcelain that wraps around the fronts of your teeth and maybe even between your teeth and around the sides. So it's not a full coverage cap, just like a little thin layer that changes the aesthetics and the color of your teeth. So our first step in the veneer process is a consultation. So in this consultation, we're going to talk about your treatment goals. I want you to bring in pictures, inspiration, smiles you like. It could be people you know, celebrities, models, whatever. Pictures off Instagram. I want to see all of those inspirations. We're going to take full mouth x-rays, a CBCT or a pano that goes around your head. We want to make sure that your jaw joints are healthy, that you have no TMJ or things that we need to address. We want to make sure that you don't need any teeth pulled. We want to make sure that you have no decay. We have to treat those things first. Then we're really going to dive into what it is that you want. If you want a brighter smile, we need to see more teeth and we're removing gum tissue. If we need to put you in clear aligners or ortho first to get your teeth in better alignment. We're going to identify all of those things during our consultation. After the consultation, during the consultation, we're also going to make sure that we take clinical photos. We want to document the journey, but it also allows us to communicate with our ceramists and our lab so that they can help us design the perfect smile for you. After this, we take an intraoral scan. We compile all this information. I print off the photos and write really detailed notes for our ceramists. We send all of that to the lab and they come back with a digital wax up that they send to us. We print it in-house and we're ready to make your stents. The digital wax ups kind of look like this. So we take what you have existing and we basically reform the teeth using digital software. Old school ways, they would just take an impression, pour it up, and actually use wax. But now we use digital software to design your new smile. So it'll look something like this. And, we're able to communicate with you. I may record a short video and send it to you via phone so that you're able to look over the result, see if you like everything. If there's something you want to change, something you're not sure about, we can go ahead and do that in our design phase to make sure that you really love the smile. We'll get your pricing at the consultation and after you have your wax up and we can get you scheduled for your prep appointment. So after your consultation, we are on the schedule, you're excited about your smile, you come in for your prep appointment. What that looks like is those appointments are typically longer appointments. So come relaxed, loose fitting clothes. We're going to give you some headphones, you can listen to music, you can watch TV. Want you to be comfortable. You're going to be numbed up. We're going to get to work designing the smile. During this prep appointments, I know people see on TikTok and Instagram pictures of preparations that look like they've shaved a whole bunch of tooth structure. But the purpose of veneers is to actually minimally prep the teeth. So we want to stay in enamel. We're removing less than 0.5 millimeters of tooth structure in most cases so that we have the best bond strength for your veneers. So it's very, very minimally prepped. And you could barely tell. We're basically just making sure that the lab has enough room to overlay the porcelain and to give you the smile of your dreams. So that appointment takes a little while. After we've prepped you, we're going to take impressions. Usually we do a digital intraoral scan like we kind of did when you come in for your consultation for the wax up. That scan of your preparations is then sent to our ceramist and they will begin to work on your smile. After we've scanned you, so we've prepped you, we've scanned you, we've done a lot of the hard work, you've gotten a break, you've had a snack, and now it's time to put on your temporary veneers that come from that wax up that we discussed. I usually try to do my temporary veneers in a very bright white color. A lot of times when patients come to us, they want a brighter smile, not just bigger. So by me doing a very bright shade of temporary material, it allows us to communicate with each other and allows me to communicate with the lab effectively. So if we like the bright white, then we stay with it. I may add some additional details so that it's not a big chiclet. There's dimension, there's shades, there's translucency to give it the most realistic look as we possibly can. But if we don't like the bright color, it allows us to communicate in a way that we can communicate with the lab tech about your skin tone, the shade that you don't like, why you don't like it. Do we need to add more? Do we need to pick a completely different shade? So that is why we pick a really bright white color. After we temporize your veneers, we go in, we try to do some fine details, make sure that we're opening up spacing, making sure that it doesn't look like one big block on your teeth, because the goal is for you to test drive that smile until your veneers come in. It's also used as a communication tool with the lab. So they know, based off the wax up, based off the scan and how I've redesigned the temporaries, how we can best enhance your smile and give you the smile of your dreams. So great. It's been a couple of weeks. You have your temp veneers. You love them. We've communicated with the lab, and you get that call from our front desk saying your veneers have come in and we're ready to get you on the schedule. So for that day, again, it's a little bit of a longer appointment. You come in, relaxed, excited, dress you up with headphones, and we are going to take off those veneers. We're going to clean your teeth, make sure everything is good. We're going to try in those veneers and get your approval and okay. Once you see them in a try-in state, we prep your teeth and we're ready to begin our cementation process. That process is very meticulous and technique sensitive. We're moving quickly. We have, before cement cures, we want to get everything in position, make sure everything is nice, and we're cleaning up that cement as we go. So once we've done that, we're cleaning up cement, we take final radiographs, we take final photos, we let you take a look at your smile, see how you like it. We check your bite, make sure it's not hitting crazy, that everything is balanced so that you don't chip any of the porcelain or break any of the restorative material. And you're kind of ready to go from there. We usually schedule you for a 24 to 48 hour post-op if the schedule and your schedule permit. When we do that, that just allows us for you to not be numb, for you to see family, friends, coworkers, and see if they notice your new smile, get feedback, see what you like about it. What's really important with veneers is veneers that are really well done get better with time. Your gums heal within like 4 to 6 weeks, more healing in 4 to 6 months. And so then your gums start to fill in those areas that you may be able to see so that it looks more realistic. They look more like your teeth. Your color begins to settle. Your teeth become rehydrated. From being open that long, they become very dehydrated, and that can change the color of the teeth a little bit. So just know that veneers are kind of like a fine wine. They get better with time. As far as regular maintenance, you still want to brush every day, twice a day, sometimes 3 times a day. You still want to floss daily. I prefer a water pick, but manual floss is okay as well. You want to make sure that we've removed all the cement and that you can still have excellent oral health care, because that is what's going to prolong the life of your veneers. You want to make sure that you keep coming in for your regular dental maintenance. That means if you're on a perio recall and we see you for cleanings every 4 months, continue to come in for us to see you every 4 months. If you have regular cleanings, come in every 6 months for us to still clean your teeth, to look at things, catch disease, broken veneer, chip veneer, whatever it is, let's catch it sooner rather than later. If you can take care of your veneers at home and you're keeping up with your regular dental maintenance in office, veneers can last upwards to 20 to 30 years before they need to be redone. So if you are interested in veneers, you don't even have to be a resident of North Carolina or Fayetteville, but if you are watching this video and you're impressed by the information, you want to learn more, I encourage you to schedule a consultation. You can visit our website at www.boutiquedentalandimplants.com, or you can give our office a call at 910-778-1229. We can't wait to welcome you.